kid in school who wore braces, or maybe you were that kid. By the 10-year reunion, perfect teeth. Crooked, misaligned teeth can really do a number on a child's self-esteem. The good news is that today's technology can straighten things out and in a shorter period of time, and people might not even know you're wearing braces. Here to show us how, please welcome orthodontist Dr. Heather Brown and her patients, Alex and Danielle. So Alex and Danielle are sitting over there getting ready to go back to school. All right, there are so many different ways to straighten teeth today as compared to there was years ago. There are your traditional metal braces.
Right, we have the traditional metal braces, which Alex is actually wearing the traditional braces. You want to smile,
Okay. And so why did you decide to get the traditional metal braces?
A lot of my friends have them, and I like the way they looked.
Yeah, it's almost an accessory, isn't it?
You get to change your color, so they're a lot of fun. The kids love them.
Yeah, all right. So you have the traditional metal braces, and let's take a look at some kind of before and after pictures of the difference that can be made with those kind of braces. We have those pictures up there. All right, those are coming, but while we're talking about that, there are also clear braces,
right,
which kind of look like the metal braces in terms of structure, but they're clear.
Right, they're a little bit more cosmetic, so they're not as noticeable.
Yeah, and then there's the so-called Invisalign, which I'm wearing right now. You had no idea I was straightening my teeth right now, right? Right, so, okay, so there's the clear braces right there.
Right.
And then the Invisalign, which is kind of the newest technology, I would imagine.
Right. The Invisalign are clear aligners that you can hardly see. Actually, Danielle is actually wearing the Invisalign Teen.
Okay.
And she has them on right now.
Invisalign Teen.
Yes.
Okay. Let's see. Smile for us. And no one would know that you were getting your teeth straightened. And so, Danielle, for you, this is a better option, you thought?
Yes.
Yeah. Why?
Because I model at Nordstrom and Neiman Marcus, and I didn't really want anything noticeable.
Yeah,
she's
braces.
A model.
Yeah, okay. Right. Speaking of, you said Invisalign Teen.
Right.
When should a child come in for braces? Because I know there's that awkward stage when kids start losing teeth and the permanent teeth start coming in, where the teeth are crazy no matter what. They're just crazy looking.
Well, the American Association of Orthodontists recommends that all kids be seen by an orthodontist at least by the age of 7. So that's a good time to actually have them come in just for an evaluation.
Yeah. Now, in terms of the metal braces and the Invisalign, is one better than the other, or is it just a matter of
personal preference? Personal preference.
Okay. And I love the way that Invisalign works, because literally right here is so you can see. This is made to fit your teeth close up. All right. And there's by the way, before so far of Alex, right?
So Alex was concerned about her canine, which was really out of alignment. So she chose to go with the traditional metal braces.
And then
Danielle, she was really concerned about the crowding of her lower teeth.
Yeah, and speaking of crowding, there's something that we can do today to go ahead and prepare for what you know is coming down the road that can shorten the amount of time that you wear your braces. We have Jenna Rutland, who is with us in the audience, and there are the expanders, so-called expanders.
Right. Well, Jenna is 8 years old, and she's actually in a functional appliance, where she has a functional appliance on her upper and her lower jaw. They were actually used to correct a crossbite. So this is really good because now it'll actually decrease her treatment time when she has to wear braces later on.
Okay, so that's the cool thing too. So you might invest a little bit up front, but you save it on the back end.
Exactly, exactly.
Okay, what child would have to do something like that?
Well, someone that has a deficient jaw growth, such as Jenna, her upper jaw was deficient in growth, so we had to utilize those expanders to help develop her jaw relationship.
Okay.
And it can prevent having to have surgery or teeth removed later on in life.
Yeah. And then after you get your teeth straightened, sometimes that's not enough to just wear it for that duration. You have to wear...
So you have to wear retainers,
which
that's very important.
And then the retainer is for anyone who gets their teeth straightened, or it just depends on the situation?
Anyone who has braces needs to wear retainers after the treatment is completed to prevent teeth movement.
Yeah.
And so this is a before and after picture of Ethan. He was mainly concerned about the spacing in between his 2 front teeth, and that's his final image. And because he's worn his retainers so well, he has a beautiful smile still.
Yeah. All right. And so, again, those retainers for the rest of your life?
Pretty much, yes. I always recommend, as long as you want your teeth to stay straight, wear your retainers.
Yeah. All right. So the question you're oftentimes asked as soon as somebody has gotten braces, the next question is what?
When are they coming off?
Yeah, when are they coming off?
Oh, my, you just got them.
Yeah, yeah. But there's a new technology that's pretty cool that can actually accelerate or cut down the amount of time that you have to wear those braces.
That's correct. We have what we call the Excellident Aura. It's a mouthpiece that you actually wear 20 minutes a day, and it creates what we call soft pulse technology. There's small micro vibrations that actually accelerate the bone remodeling process, and it actually increases tooth movement anywhere from 38 to 50%.
Wow.
So you can pretty much get your braces off in half the time. In some cases.
If you're going to wear Invisalign for a year or braces for a year, you could 6 months you can get them off.
That's true.
That's amazing.
It varies.
And literally you just kind of hold that.
Right. We have it over here.
Yeah, let me take a look at that right there.
All right. So it's really neat, compact.
You chicken ear.
Yeah, if you just press the button there.
Okay.
Right into it. Yeah, you got it. Can you feel the small mini vibrations?
You know, she can understand exactly what I was saying because she's a dentist, and they can understand a whole nother language. But what is so cool, I got lipstick on, I'm sorry.
That's okay.
But what's
That's
cool
yours
about that, you know, this is mine now. Can I do the rest of the show like that? All right, so it sounds like what you're saying is that the big deal is obviously you got to come in and find out where your teeth are, and it's something as a dentist that you can tell what's happening below the gum line that a lot of times we can't see.
Right.
And so that can determine what treatment plan is best for you.
Exactly.
And there's a point of preference if you want to wear the full metal braces. Like my son keeps saying, Mommy, I want braces. I go, why? He goes, they're cool looking. That's not why we get braces, son. But, or like I said right here, I got my little Invisalign right here. You can work with it, take it out when you eat, brush your teeth, put them back in, and so you're fully functional there. Well, Dr. Brown, this I think is just amazing because
it's
again,
really great.
Cutting down that time that you have to wear those braces. Dr. Brown has a special promotion for Great Day viewers. For the first 30 callers, you can get $1,000 off Invisalign. That's fantastic. $1,000 off Invisalign treatments. And $500 off clear braces. Of course, what you get in return is something priceless, straight teeth and a great smile. To make an appointment or for more information on Dr. Heather Brown, call 713-665-4455, 713-665-4455, or go to drheatherbrown.com. Thank you very much.
You're welcome. Thank you.
Well, here's something to smile about. A new